Good morning. It is Monday, August the 8th, 2022. Welcome to another edition of the National Newspaper Publishers Association's Let It Be Known. According to updated guidance from the Centers for Disease Control and Prevention, sexually active Americans should consider limiting partners and avoiding sex parties to reduce the risk of contracting monkeypox until they get vaccinated. The revisions come a day after the Biden administration declared the growing monkeypox outbreak a public health emergency, and as experts, LGBT advocates, and health authorities debate how to convey messages about sexual transmission of the virus. Monkeypox is not considered, the CDC is emphasizing, not considered a traditional sexually transmitted disease because it primarily spreads through close contact with lesions. But global data suggests skin-to-skin contact during sex is fueling the outbreak, which has resulted in more than 7,000 infections in the United States and 26,000 worldwide. Cases that have been reviewed in detail show that infections are overwhelmingly among gay men. We are in contact with officials from the CDC. So throughout this show, throughout the rest of the week and in the future, we'll bring you more information. But we're talking about prevention more than anything else. We're talking about how to stop the spread of monkeypox and other viruses in our communities. We'll discuss that with Dr. Anthony Harris, who is an infectious disease expert. But first, let's bring on James Wright of the Washington Informer as we bring you up to date on what's happening on this Monday morning. James, good morning.
Good morning, Stacey. Good to see you.
Always good to see you, James. A couple of quick news items. James, Senate Democrats took a critical step toward reducing inflation and the cost of living by passing the Inflation Reduction Act. Proponents said the measure would make a big difference for many Americans by locking in savings on health insurance premiums and reducing the cost of prescription drugs by allowing Medicare to negotiate lower prices. So, James, the bill, when signed by President Joe Biden, should also lead to creating family-sustaining jobs and cutting energy costs by making the most significant investment in history in combating climate change. All Democrats who voted said that this will do just that. And, of course, Kamala Harris, the vice president, issued the tie-breaking vote in a deadlocked Senate to make sure that the bill was passed. The country will pay for the bill. Importantly, James, we should note the bill which has a $739 billion price tag. They're going to pay for this by making corporations pay their fair share. Those making less than $400,000 annually won't see tax increases. So, good news out of the nation's capital, James.
Yes, this is excellent news. And this is particularly good news for seniors, and I'll tell you why. You have Medicare will now negotiate for prescription drug prices. Stacey, I don't need to tell you that prescription drugs are off the chain for a lot of Americans. You have Americans doing things such as cutting their medicines in half in order to sustain their supply, increase their supply, I should say. And you have people making decisions, should I pay my rent or my groceries versus my prescription drugs? By having Medicare negotiate prescription drug prices, this increases the options and lowers the cost for people. Also, the climate is very, very important because this is really the first time the federal government has addressed comprehensively in terms of dealing with climate change and governmental policy on that. I know the Kyoto, I'm saying this wrong, the Kyoto agreement, we were a part of that until Trump pulled us out, and I think Biden put us back in. But the point is that as a government ourselves, we are addressing climate change, and that is very, very important. This is a good bill. I'm glad the vice president, and obviously she was going to do this, but I'm glad that the Democrats united in order to pass this very good bill.
Yeah, absolutely. And this morning, I want to say congratulations to our own Cheryl Smith, the publisher of iMessenger Media, the Garland Journal, and Texas Metro News. Cheryl was inducted into the National Association of Black Journalists Hall of Fame over the weekend in Las Vegas. Cheryl is a job well done. If anybody has seen the Texas Metro News, picked up the Texas Metro News and her other publications, you'll see why, at least part why, Cheryl is now an NABJ Hall of Famer. Congratulations again to Cheryl Smith. We certainly look forward to talking with Cheryl again soon about this great, great honor. So, James, the conversation now turns to monkeypox. Let's bring on our expert, Dr. Anthony Harris, to discuss what we can do as a community to prevent the spread of this really terrible, terrible virus. Good morning, Dr. Harris.
Good morning, Stacey. How are you?
I'm doing well. It's great to have you. First, let me just say, Dr. Harris, explain it to us, actually, a little bit about this monkeypox that now has affected 26,000 people worldwide.
Sure. So, and thanks for having me on, Stacey. James, it's a pleasure to meet you and pleasure to see you here. So if we're talking about monkeypox and its origin, right, it didn't just pop out of nowhere, so to speak. It's been around for several decades. And what we know is that monkeypox was traditionally only in the Central and Western Africa geographics, right? And the disease itself is called a zoonotic disease, meaning that it came from animals, right? And you normally or historically had only contracted monkeypox by being bitten or scratched by an animal, typically a rodent, not monkeys, typically a rodent that had monkeypox. And that was for, again, decades, the spread of monkeypox. And so what we've seen now in today's time is a drastic deviation from that classic transmission profile, meaning that it is now transmitted in a community spread from human to human. And that's basically the first time this disease, monkeypox, has done so. And that's why it's concerning, because it's made that transition from a mutation, evidently. Still more research is ongoing, but monkeypox has two types of strains, so to speak. One is typically in the basin of Congo, and the other is West African. So the one we're seeing propagate right now appears to be the less virulent version, thankfully, of monkeypox. The statistics are about 99% of people do okay once contracted with monkeypox in terms of recovering. And that recovery takes about 3 to 4 weeks, typically. But the Congo Basin version has a 10% fatality rate. And so it's not a trivial disease in terms of potentially causing harm to large number of people in the population.
And Dr. Harris, so we hear so much, we always talk about misinformation and disinformation, but on places, social media, right, Twitter, TikTok, you name it, casual conversation, you hear people worried about getting monkeypox from a handshake or even touching someone at a music festival or sitting on a bus or an airplane. I've heard some people say, well, when you go to a hotel, you better bring your own sheets. Tell us about that. Is it that easily to be transmitted? Should we be that vigilant?
Sure. So it is wise to have in mind scenarios in which you may be exposed to monkeypox. Now, we know that transmission of monkeypox, to be specific, it can happen from particularly prolonged skin-to-skin contact, right? And that's with lesions, someone infected with monkeypox. Through close contact with body fluids and others, a type of secretions, is still ongoing research to understand to what extent that level of transmission is occurring in the population currently. But certainly, if you are interacting with someone's lesions and the fluids, the pus, so to speak, from those lesions, and lesions we're talking about kind of evolve over time. Starts with like small bumps, pimples, if you would, and then they can open, and that's where you have exposure to monkeypox virus. And then they crust over, if you would, and that kind of signals the end of the transmissible disease for that individual. But if you are in a concert, you mentioned, right, and you're jam packed and you're having a good time, but the person you're standing next to, God forbid, does have monkeypox, and you have prolonged skin-to-skin contact with them throughout that concert, is it possible to contract monkeypox? And the answer is yes. To what extent we're seeing that actually occur, again, is an unknown, right? We know that for right now, the research is pointing towards men who have sex with men as the highest risk for monkeypox in New York State, in Illinois, in California, in which of these states have all declared emergent states of emergency. So the notion of, if I contact materials or cloths or clothing that was soiled by someone with monkeypox, I may be at risk for contracting. So it is, in theory, possible for that scenario to play out as well. It's perhaps less likely than having direct skin to skin in terms of risk of transmission. But it is something that, again, bringing about awareness will help prevent. Does it mean that you need to, be vigilant enough to bring your own sheets when you go to an hotel? Most likely not, right? I mean, again, facilities, hotels, hospitality, they've all been dealing with COVID over the last 2.5 years, right? And so they've put in place means to sanitize the room sufficient to very likely prevent spread of monkeypox too. So I wouldn't go as far as to say we need to have that level of vigilance, but again, awareness and knowing that you may be at risk when you're in large populations of individuals and you're going to have prolonged skin-to-skin contact potentially.
Yeah, we see before I turn it over to James Wright, we see again the highlight of and the CDC says this, which for me it just amazes me a little bit. People are free to do what they want, but this multiple partner thing, I mean, we have to, don't we have to be more responsible too when it comes to these diseases, these even with COVID, right? You had to be responsible. If you didn't want COVID, you knew what. If you don't want COVID, because COVID is still here, the steps you can take that will mostly prevent it. Mask, vaccination, things of that nature. And now the CDC is saying that it's close contact, sexual contact a lot of times, and as you just described as well. And they specifically talked about sex parties and multiple partners. At some point, we have to be responsible, right?
Absolutely. And if we look at the basics of transmission, right, it all but makes sense in that there's something called the R naught, or reproductive rate of any transmissible disease. And so in this case, obviously, we're talking about monkeypox. And so what does the R naught mean? It means essentially how many individuals typically for a disease are infected by one person that has the disease. Right. With measles, that number is tremendously high, 14. So one person can potentially infect 14 individuals because the rate of transmission or the susceptibility for measles is very high. For example, with COVID, that number began around 5 to 1 to 5. One person infects 5 people, and it had gotten as high as 14, even 11 to 14, with the different variants that we saw emerge during COVID. Now with monkeypox, that R naught number historically, when we looked at early transmission, was just approaching 1, meaning that the disease was growing, 0.85 in particular, and now has estimates of about 2.13, meaning that for every individual who has monkeypox, they're infecting about 2 other individuals. Now, that is all predicated on number of people you come in contact with that may be susceptible. And again, if If you are in an environment where, such as a sex party, where you're having a lot of close, intimate skin-to-skin contact, and it's a number of partners, that's going to potentially put you at higher risk just based upon how the transmission of this illness is occurring in this current time. Again, historically from animals to humans, now from human to human. It's not respiratory, right? So it's not necessarily someone coughs and the particles that float around in the air, usually around 5 microns or smaller, can cause transmission. That's not what we're seeing, right? Again, it's limited right now to spread by close skin-to-skin contact primarily.
Yeah, we're talking with Dr. Anthony Harris, who is an expert on these type of diseases, the spread of communicable diseases. He's also the CEO medical director of HFit Health. James Wright, I'm going to bring you into the conversation.
Thank you, Stacy. First of all, I see, Dr. Harris, you have an MD, an MBA, and an MPH. So obviously you did your homework. So congratulations when you were in school. Dr. Harris, I want people to really understand this because I've seen this script before. In the 1980s, you had the HIV/AIDS scare. And the first thing that came out is that that gay men, this was a gay disease. And could you clarify whether this is a gay disease? Because that's all over social media and in conversation. And I know you heard the story about Magic Johnson not getting in the pool at a party in the early 1990s because he was diagnosed with HIV. And there was a concern that he would spread the HIV in the pool, that sort of. Are we looking at that type of talk and nonsense? Second of all, this disease, how much do we really know? And when I say we, I'm not talking about myself, but the medical community in the United States know about monkeypox. Is it taught to the extent that it could be in medical schools?
Sure. So to work our way backwards, historically, medical school training, you learn about a myriad of diseases, right? Is monkeypox in particular one that stands out? Not so much, right? Smallpox, yes. And these are all in the same category. So smallpox, monkeypox, cowpox, camelpox even, right, are all in this same class of disease. So we do know quite a bit about monkeypox as a result. It's been around, again, for several decades that we've known about monkeypox. We have been studying it, particularly in the Congo Basin. And we've seen during the 1980s, since the 1980s, a 14 times increase in the number of monkeypox cases over time, right? So this didn't just crop up overnight in terms of monkeypox here in the U.S. It's something that we've been looking at for some time. And the theory behind it, to kind of get back to the first part of the question of, from whence it came, is this a gay disease? The answer is no. Unequivocally, this is not a gay disease. This is a disease that is spread from skin-to-skin contact. The only mention of why we're pointing out the population at risk in this case, what we're seeing from cases in the U.S. is by nature of how it's spread, which is close skin to skin. Again, COVID, which became a respiratory transmitted illness, right? And so there was no talk of a high risk if you had close sexual partners because that wasn't the means of transmission. So when we're talking about monkeypox and its evolution over time, again, this is drastically different, that it's transmitted from individual to individual in community spread. What we've seen in terms of outcrops of monkeypox over the decades typically is that it never had community spread. Again, I mentioned that R naught number being 0.85. Any number, and when we're talking about R naught, the reproductive rate below 1, meant that the disease kind of fizzled out before it had a chance to cause an epidemic type or even pandemic type presentation in the community. The fact that, again, the R naught in this case is higher than 1, again, around 2, just over 2, means that it has potential for spread. That is why WHO, part of the reason why WHO has made this an emergency, why the U.S., the Secretary of HHS, Health and Human Services, has made it an emergency, and why states have already declared it a state of emergency, because of the potential to have devastating effects in vast number of people. beyond the men who have sex with men communities. And so it's something that we need to pay attention to. Again, we're not at a state of alarm, right? We heard Anthony Fauci just this week mention that, this is something where we're in the phase of awareness, the phase of prevention, but not the phase of panic. So I think the rhetoric that you're hearing in terms of it being a gay disease or it being something that is fabricated, or even some that have gone as far as to say it's a hoax, it's not, and it's not a gay disease. It's something that we've known much about. We've just unfortunately seen more of it now. Briefly, I'll tell you more history of why we're seeing it now versus perhaps before. Some of the research shows that since the 1980s, we were vaccinating globally for smallpox, right? And smallpox vaccinations historically have had 85% of efficacy against monkeypox. But with the eradication of smallpox, nations stopped vaccinating against smallpox. And as a result, we now have we have loss of what's called herd immunity, meaning that the susceptible populations, that number grew because they were no longer vaccinated against smallpox and vis-a-vis monkeypox. And so now we have more spread and potential of monkeypox, and that's why we've seen that increase in the Congo Basin of a 14x number.
Yeah, Dr. Harris, we're not going to tell anybody to drink bleach, are we?
I hope to God no.
I want to lift up what Paris Brown of the Baltimore Times wrote in. She has a question, Dr. Harris. She says, "Can you speak to cases concerning women? Is this an issue that women should be concerned with also?"
Absolutely, I'll say yes. Women should be concerned with this also, as should the general population, right? Just something that we need to pay attention to because it is being spread with close skin contact, human to human. And the telltale signs of monkeypox are the blisters, right? They usually crop up about 1 to 3 days after onset of fever from an individual that became infected with monkeypox. And so, the awareness we're speaking to now is just to be cognizant that if you do see concerning lesions with a partner or with individuals you are cohorting with, pay attention and take precautions.
Yeah. Dr. Harris, too, as we see those images, which are really, really, they are something else. When you see that, it certainly should make you say, no way do I want that. But, we keep hearing, we heard with COVID, we hear with so many of these infectious diseases that they disproportionately affect Blacks and Hispanics. Now, other than some of the obvious health care reasons, right? Why does this seem to be the case that all of these, when we hear about it, they disproportionately affect Black and Latinos? And what can be done about this? What should be done about this?
Sure. So there are definitely some social determinants of health. We know this, right? WHO, CDC have been studying the social economics of public health for some time. And what we've seen, particularly if we kind of take a look at spread of COVID in the Black and Brown community, which has been disproportionate in terms of impact, severe outcomes, there's various reasons, right? And if we look at risk population, we know, for example, with COVID, that there are a high proportion of individuals with diabetes, right? With obesity and other risk factor. And so these risk factors have been chronic illnesses impacting the Black and Brown communities more, and made thus those communities more susceptible to COVID. Now, for monkeypox, right, some of the social implications from a health determinant standpoint is just these scenarios in which our communities exist. We know that in the Black and Brown communities, we may have a higher density of individuals in one house, right? And that's a statistic that we know increases risk for transmissible illness. Going back to the reproductive rate, it literally is the number of people you have contact with. And in particular with COVID, we know 85% of transmissions happened in the home. So if you have, not just 2 people living at home, you have 5 or even more in one domicile. That is, not a ranch or a 10,000 square foot facility, right, or home, but a smaller setting. You're going to have more intimate contact with individuals in that setting. And so even the social economics of Black and brown communities does play a role in the transmission of illness. And in this case, with close skin to skin contact, it may be a factor. Now, I'm not speaking to any statistics that we've been able to examine thus far with regard to monkeypox and risk factors, but certainly being cognizant of the aspects of the socioeconomics in our communities is something that's only going to help us when we're talking about prevention.
Yeah, James, I'll throw it to you for another question for Dr. Harris.
Yeah, Dr. Harris, our producer has a very interesting question because I just came from a doctor's appointment 2 days ago. Should people run out and get vaccinated just willy-nilly? And will vaccination protect you from infection?
Sure. So when we're talking about vaccines, right, the quick answer is no. Don't rush out and get vaccinated unless you are at risk in the populations that we talked about. If you do have a lot of partners, sexual partners, we mentioned the men who have sex with men being the population at risk. There is strong recommendation from CDC to get vaccinated in that population, in those at-risk populations. And again, going beyond just men who have sex with men, if you have a lot of sexual partners, period, you should consider vaccination. And certainly we see New York State having big vaccine push efforts. And there will be even more now that we have the emergency declaration, because there's more access to funding, speed to production of vaccines. And to touch on the vaccines real quick, there's typically 2 types of vaccines that have been historically used for monkeypox, or for smallpox in particular, but monkeypox does have an approved vaccine in the U.S. And so it is something that is available if you are at risk.
Yeah. So that was. I'm glad you talked about the vaccines and vaccine availability, because that was a huge thing when the vaccines for COVID were announced. It was, many wondered, where can we get vaccines, and also it was just such a such a problem getting vaccines at first. Are they readily available for monkeypox?
Sure, and they are, right? So the first vaccine is Jynneos. It was approved back in September of 2019. So it's been around and it's available. The other that in particular has an efficacy of 95% against smallpox. Okay, so that's very good news in terms of its utilization. AMCAM is the other one that was approved back in 2000. And so the one that is right now, I believe, what I would recommend is the Jynneos with the high efficacy, lower side effect profile. And so it's something that, yes, you can access with your healthcare provider. Obviously, talk to your healthcare provider about your risk factors, and if appropriate, getting vaccinated would make sense.
And the vaccination does protect against the disease?
Correct. 95% efficacy against contracting monkeypox.
Mm-hmm. And so I can talk to my primary care doctor. I can talk to which doctor should I talk to ask about the vaccine, to have access to this vaccine?
Sure. Talk to your primary care doctor, and also talking to your public health officials, right? Your Department of Public Health. They would also have access and information in particular for what's available in your community.
Yeah. And just to be clear, getting vaccinated does not mean you can't get it. Is that, well, I know that to be the case with COVID. Is that the case with monkeypox?
It is, as it is with any vaccine, right? There's no vaccine that's 100% efficacious at preventing illness, right? And so we know that there still will be breakthrough cases after vaccination. But the optics of that is how effective is the vaccine. With COVID, we saw effectiveness range, depending on which manufacturer, from 60% up upwards of 85% efficaciousness, right? With smallpox and the vaccines that we've used over the decades, as well as the approval of Jynneos for monkeypox in 2019, that efficacy is very high, 95%. And so that's the positive news around prevention with vaccination, particularly for monkeypox.
Yeah, folks, monkeypox is a U.S. health emergency declared by the president. CDC agrees with the president, and so does the World Health Organization. And it's so great to have Dr. Anthony Harris this morning. We really appreciate you for bringing such vital information and really emphasizing how can we stop the spread in our community. We really appreciate your jumping on this morning, Dr. Anthony Harris. Everyone, stay tuned for more information on this and other things that can really help us in our community right here on Let It Be Known. We will see you tomorrow.